I'll go in reverse on them. Well, first of all, with respect to our call here very shortly, I'm sure, I don't know whether the federal state of emergency will be a topic on that call. I would expect that it could be. But for certain, there may be some opportunities for us to work closely with our federal government to align some of the restrictions and, in fairness, some of the resources that are being offered as well. And we did that last week, trying to dovetail in on some of the federal resource package that they had put forward to, if you could, fill a gap here and there and enhance some of the opportunities for Saskatchewan employers and employees. So there may be that opportunity. There will be that opportunity to have that discussion here today, and I think providing clarity for all of the people of Canada where we can, maybe not in every case, but where we can, I think would be very helpful, and also helpful, if you would, in addressing some of the anxiety that people are feeling because there is this great unknown that we all have as to what is going to happen, and what are the rules that we're operating under. Can we go out for a walk if we're social distancing versus self-isolation? What can we do? What can we not do? So the clearer and the more clarity that we can provide across this nation, I think, would be beneficial for everyone on many levels. In some instances, I think if we were aligning with other provinces very closely, you would see some of the initiatives in Saskatchewan come a day or two earlier. In other cases, I think you would see them come a few days later, as we were the first to move on actually using our state of emergency, if you will, to ensure that it is the law of the province that people do self-isolate when they return from international travel. We've seen others starting to look at this now, but with respect to Steph's question around 25-person gatherings versus 5-person gatherings, that's something that we're actively discussing at the moment, as well as a number of other restrictions and some other resources that we may be able to provide, quite frankly. All options are being discussed by Cabinet today and tomorrow, and will be into the days ahead, as how we can best support Saskatchewan people and provide safe communities here. So there is cases where we might move a day or two earlier. There's other cases where we might move a day or two later.
And as for interprovincial border restrictions, is that something that you foresee being discussed on this call, and it's something that you would advocate for?
It's something that's been advocated for with me by Chief Bobby Cameron and a few others. We see some other provinces starting to look at this. I'm not sure exactly how that would get policed. It might be a little bit challenging to police between the provinces, given all of the border connections. Prince Edward Island might be a little easier with one bridge versus Saskatchewan, that has many connections from north to south on both our eastern and western borders. So that likely will come up on this call as well. What we have chosen to do, and I know what other provinces have chosen to do, and I hope that all Canadians, and this is a place where this is an opportunity and maybe an example of how all premiers and the Prime Minister could speak very loudly and clearly so that all Canadians would hear, is if you don't absolutely have to travel, you shouldn't be. You shouldn't be crossing the interprovincial borders. You should be staying at home where you can. If you're not providing an essential service in your community, and your place of work is not actively working today, you should be considering staying at home, practicing social distancing, and spending some time with your family if that's the opportunity. So I don't know how you would police interprovincial travel like we have put into law the international travel, but I think it should be a very strong recommendation, and it is from this province, and I know it is from other provinces, but that might be an example of something collectively we could come out of this call on and saying, as all Canadians, you should stay put where you can.
Steph.
Mr. Premier, what should people do if they are still having to go to work because for whatever reason their workplace remains open, and they are being put in situations they themselves don't consider safe? So maybe there's not enough social distancing, they're still required to travel for work. What should an employee in that kind of situation do?
Well, it's my true hope that all businesses are doing everything they can to provide the opportunity for social distancing. And I think it's incumbent on each of us as individuals to have that discussion. Have that discussion not only at work but in your daily lives as to what is an appropriate distance for us to be apart and be open to bringing that up in our conversations. But I hope all employers at this point in time, and this is again an example of how additional clarity will help, if you will, in providing the difference between self-isolation and social distancing. What is an appropriate distance for us to be apart? And I hope all employers are not only encouraging that, but really putting their best foot forward, if you will, by ensuring that their employees are practicing social distancing. Listen, as we go into the days ahead as well, and I think this is important, and maybe some of it will come from the phone call that we'll have with all of the premiers and the Prime Minister, there quite likely is further restrictions coming. There quite likely is further action that will be necessary. We'll leave that to the recommendation of the Chief Medical Health Officer here in Saskatchewan and his colleagues across the nation. But we are seeing the infection rates increase, not decrease. That means that our work is not yet finished. We feel that we have addressed some of the largest challenges, if you will, in the days ahead in a number of people returning from international travel, as we have a cold winter here. But there's a number of people who are returning from international travel. We've put very strong mechanisms in place to ensure that they are self-isolating. And if required, and on the advice of our Chief Medical Health Officer, if we need to look very seriously around essential services being offered, and nothing else, well, then that's a bridge we'll cross when we get to it.
Are you concerned about, or how concerned are you about civil liberties being lost or jeopardized as we anticipate kind of further restrictions, and even the federal health minister has indicated that's maybe a potentiality? How concerned are you?
I'm concerned about a number of things. Not only our civil liberties, as we move through trying to manage a pandemic that, as I've always said, really shouldn't affect in a large way, by the statistics, someone of my age, but it would affect the generation older than me in a much different way. So I am concerned with respect to some of the efforts that we are making and how that impact will have on civil liberties. I'm also concerned how the decisions that we're making today and the impact they're going to have on the general state of the economy, and what that starting point is going to look like when we get on the backside of this curve, and what opportunity we're all going to have as people that are employed in this province, the opportunity that we're going to have to go back to a place of employment when we find our way through this pandemic. So, our first and foremost priority right now is providing the opportunity for us to flatten the curve so that our healthcare system in this province can manage what we know is coming at it in the weeks and quite likely month or two at least ahead of us. Alongside of that, we're trying to balance that with respecting individual civil liberties, people's civil liberties, as well as those of society, but also trying to balance that with the impact that we're having on the economy.
We're going to go to a question from the phone lines. Operators, there a question on the line?
We have Chris Vandenbrekel with 650 CQAM.
Hi there. Can everybody hear me?
We got you, Chris.
All right, perfect. I wanted to ask, and I'm not sure who can best answer this question, either Dr. Shahab or Dr. Shaw perhaps, but how many beds do we need to free up in Saskatchewan to prepare for a potential surge of coronavirus patients? And how many have we been able to free up and prepare so far?
Dr. Shaw?
I think Dr. Shaw or Derek Miller on the line would be best.
Susan Shaw, Chief Medical Officer with the SHA, and Derek Miller, Incident Command Chief. So we are constantly looking at how many beds we have and how many beds are available and how many beds we need. At this point, we have, as Dr. Shahab said, no admissions identified within our hospitals that are secondary to or caused directly by COVID. We are anticipating and preparing that we will need to be able to both meet the current needs and future needs, and plans are in place for that. We have equipment ordered, we have staff being prepared, and we are ready.
Operator, we'll take one more question from the phone line.
We have Laura Woodward with CTV Regina.
Sorry, Canadian Standoff. This is Laura with CTV News. I'm wondering if you guys have any specialized COVID-19 units at hospitals right now.
Units?
Derek Miller, specialized units.
I think Derek Miller can speak to that.
Yeah, hello, it's Derek Miller, the incident commander for the Emergency Operations Center with the SHA. So currently we aren't specifically assigning units as COVID units. However, locally within facilities there are plans being made to certainly support that, and that will be an essential piece of our surge capacity development going forward.
Got time for a few more questions. I've got Karen here.
You asked mine, so.
Okay. I think Wayne, you had a question?
Yeah, just, if it's okay, just to change the topic for 1 minute. Have you had a chance to look at the mediators report of the co-op strike, co-op lockout situation? And there are some calls today from the union and the opposition to call the House back.
Oh, okay. Yeah, and, briefly, I have had an opportunity to look at some of the recommendations that came from the report. Mr. Reddy, we thank him for his work. He's, one of the most sought-after mediators in the country, and we're very happy that he was able to come and do the work that he did and come forward with the recommendations that I understand have went back to both Unifor as well as FCL, and my understanding is that Unifor is accepting of the report, and I believe maybe voting on it today, and FCL is less so. So it would be our hope that over the course of the next short while that both of those entities will continue to work together in this what is a private labor dispute to ensure that they are have exhausted every option, if you will, with respect to coming to an agreement and coming to some degree of labor peace here in the provinces, as we as well are entertaining what options are available to the government.
We've got time for one more question on the line.
We have Guy Quinville with CBC.
Thank you. I wanted to return to the topic. Oh, can everyone hear me okay? Just for
Yep.
I wanted to return to the topic of hospitalizations. As of the latest information about this from Saturday, 2 cases are in hospital, but it was due to pre-existing illnesses. I want to bring us up to speed on that, however, though, or want you to. Are any of the in-hospital patients, have any of their cases escalated in recent days such that they are now in ICU? Or do we still not have any cases in ICU? I just want to get a better sense of where our hospital cases are at, including whether we have any cases now in ICU, even if they are those who had pre-existing illnesses.
Dr. Shaw here, and I don't have that information, and if I had that information, it would not be appropriate to share it because of the importance of protecting our patients' personal health information.
We've got one more question from the room here, Adriana.
Again, so this probably would be directed to Derek Miller or Dr. Shaw. Just to follow up, you didn't exactly answer how many beds will be needed or that you're preparing for or have ordered at this point. You said plans are in place, but how many beds?
Hello, it's Derek Miller here. I will say that is I guess, the question that we all want to know in terms of trying to predict what a forecasted demand might be. We are working with the epidemiologists to forecast what we may be seeing in the future, and we're orienting all of our planning towards that. So we don't have a firm number to share in terms of the number of beds that will be required, but that is something that we're certainly focusing on with our planning right now. And in terms of physical beds, certainly ordering of equipment like beds and others pieces of equipment will definitely be driven by what that additional capacity will be.
And it's so important to emphasize that all of the planning is dependent on how effective our self-isolation measures are. The public has a great opportunity to support everybody, including all of us working inside the healthcare system. We can't flatten the curve. We were dependent on the public to be able to doing that work so that we can be best situated and best set up to meet the needs, because the needs will be less. and the needs will be slower. That's my ask of all of you.
Thanks very much, everyone. That's all the time we have for today. Thank you,
just
Premier.
make
Thank you, Doctor.
a couple of comments in closing here on Derek and Susan's comments with respect to freeing up capacity in our Saskatchewan Health Authority and in our healthcare system. And they've been actively working on just that in foregoing elective surgeries, if you will, and doing everything possible to free up some capacity in our healthcare system so that we are ready for what does come at us. And I want to thank, through Susan Shaw and Derek Miller, or Dr. Shaw and Derek Miller, all of those on your teams and across the Saskatchewan Health Authority for the efforts that have been made in literally the last number of days. The efforts that you've made in sourcing the medical equipment that we will need. And we are having some challenges, yes, in this province, much similar to every other jurisdiction in the world when it comes to ventilators and N95 masks, but we do have the rest of the medical supplies on order or in hand as we find our way into this. So I want to thank all of those in the Saskatchewan Health Authority for the preparation that they have done, and thank them in advance for the effort that I know will be coming. I began today thanking the people of the province for their respect of social distancing and their respect of Dr. Shahab's recommendations. And I just take a moment to thank Dr. Shahab for the many hours a day of work that you were doing on behalf of the people of this province, and the very competent work that you were doing, and the recommendations that you were bringing forth to the government and through yourself to the people of the province. And I don't do this often, but I also would just say a quick thank you to all of the media outlets across Saskatchewan as I talk of the need for clarity in our communities across Saskatchewan, clarity on what the restrictions are, clarity on where to go to access resources that we'll need, we know we'll need in the days and weeks ahead. I do want to thank the media for providing the information to the public in community after community in this province. It is appreciated by me, and it is appreciated by the entire government of Saskatchewan. So thank you very much, everyone.
Thanks very much, everyone.